Dr. Joshi is the best paper winner from Telangana Ophthalmology Society, whereas Dr. Samira was from Andhra Pradesh State Ophthalmology Society.
Skipped slides क्यों दिख रहे हैं? Yeah.
Has Dr. Alankita Hazarika come?
Thank you.
Oh, you are here. Okay.
I'll start.
Yes.
Thank you for giving this opportunity. So I'll be talking about an anterior segment imaging solution using smartphones that we tried in teleconsultations. We have a financial interest with a grant supporting this work. So imagine if a patient is sending you a video or an image like this from his home. Wouldn't that save time and visit for you? And wouldn't that give you a lot of information whether how to manage the patient by sitting at home, where both the patient and you can sit at home and share quality images? This is the gold standard images that we have now, and it involves bulky devices with expensive equipments, and they cannot be transported to the areas of need, which are basically children, elderly, and patients with infections who were very much affected during the lockdown. So in such cases, you need technologies which are cost effective, and basically they should be in the hands of people who are in the bottom of the pyramid of care. Smartphone is one such technology. The cameras are very advanced, but they are basically tuned for distance photography, not for macro photography of ophthalmic grade, where the optics, focus, illumination is not tuned for ophthalmic grade. So how do we bridge this gap? So what we try to do is, with this study, is build a universal smartphone attachment along with an app that can solve the problems for the patients and make this device available for patients in their own hands, in their own phones, at their own homes. So what we did is, during the first wave of COVID, we got a lot of images from patients on WhatsApp, and we analyzed them, and we found out that the main things that they are lacking is they don't understand what is the clinical frame of interest for the doctors. There is a lack of focus, there is shake, lack of standard lighting and magnification, and as a result, 84% images were not clinically good for clinicians. Plus, there is a variety of devices in a patient's hand, and they will not have the high-end phones. They'll have the mid-range phones, and the camera specifications vary. There are some devices in the market, but they were targeted mainly towards the clinicians, but none of the devices are basically targeted for the patients. So we tried to build a universal attachment. We worked in sync with engineers, and we tried to compare the gold standard imaging quality with what we were trying to develop. So we came up with a hardware which is a universal clip-on system with an app. The app kind of does most of the work. It simplifies the work for the patient, wherein I'll just show you how it goes. So in the first part of the study, where we compared the images captured using this device and app with the slit lamp photograph, and we saw that more than 70% of images were of fairly good enough quality, and the clinicians were accepting now almost to 53%, which was a significant improvement. So we finalized this protocol of how to capture the images, and then we converted it into the app. And then what happened is that the app basically adjusts the illumination, magnification to such a level that the patient just has to go and tap on the screen. The image is captured with the date, and it is archived and uploaded in the cloud. So all the patient has to do is tap. So we gave this in the patient's hands, and all you can see here are the images captured by the patient's relatives. So all those 4 parameters, which was lack of perspective, focus, illumination, resolution, improved significantly. And there was so there is a loss of adherence to protocol. That is where the app came into the picture, and it increased the adherence to the protocol. So overall acceptance by clinicians increased further to up to 66 to 70%. So this was one of the first attempt where the primary focus was patient as the end user, and not a doctor or optometrist or any technician. The patient knows how to use their own phone well more than others. We are just augmenting their ability to help them capture good clinical grade images. So here we tested it on all mid-range smartphones. We found a particular focal length which kind of suits most of the phones, and it actually eases the job. So here basically it is aimed towards identifying the at-risk cases with a need to referral to higher centers. This can be automated using AI, and also decrease the risk of save the time for the doctors as well as for the patients in teleconsultation. So this is the Grabby Light. We have trademarked this product. So this is our team with at Center for Innovation LBP have been working hard for behind this for the last 2 years. So this is the product where it's a simple device and the app interface is somewhat like this. You can archive the images and send it to the doctor in any way. So one of the patient from Jammu Kashmir, this is the image captured plain just with the smartphone, and this is with the device and the app. So it's good enough for me as a cornea surgeon. Tells me some sutures are loose, some are good. Overall, there's no congestion, no infection, and it's a very simple training process. Anyone, you don't have to sit and train the patient yourself. Any staff, any faculty can be able to do this. We do it at the optical store in LVP, and it actually helps save a lot of time, and patients really get it very easy. So that's the circle. They have to bring the cornea in the circle and tap. That's it, and you get a good quality image. So the idea of social impact strategy was that you can save a lot of visits for the patient. Like for example, this patient, we actually saved close to 10 visits for him, which was about 4 months of time, and managed him completely based on smartphones. So in the last 2 years, there has been increase in teleconsultations, quite a huge number. And the economic footfall we know is that we have saved up to 79 million rupees because of just of this environmental impact. And I feel that this device can add to this. Thank you.
Thank you so much. Very nice presentation, Dr.